For my dissertation, I looked at genetic markers that are actually associated with type 2 diabetes and obesity, which are both risk factors for breast cancer. Hispanic women usually have a higher prevalence of both type 2 diabetes and obesity, so I thought it would be interesting to see if this gene also increased the risk or decreased the risk of breast cancer within this minority population compared to non-Hispanic white women. And I did find that the genetic variation was different between the two groups of women, and that the breast cancer risk did differ based upon a particular haplotype of this particular gene that I investigated. With this work that we're doing, we're hoping to I guess decrease the gap in health disparities, or if anything, increase the knowledge of why breast cancer rates or risks differ between ethnic groups. How can this also lead to more knowledge in terms of ways that we can change things such as our diet or increase physical activity, and how these things affect us differently based upon our ethnic groups in the United States, because breast cancer incidence and mortality rates do differ by ethnicity here. So increasing knowledge is our biggest theme here.
Good evening and welcome to the LaShonda Clark Show. Today we'll be discussing health disparities. Health disparities refer to the differences amongst the health status of many different groups of people. Some of these groups may be based on race, ethnicity, gender, and there are so many more to discuss. We have a special guest today in the studio. Her name is Anna Lewis. She is one of the 23-year-old students here at Florida A&M University, and she has just been diagnosed with breast cancer. So, Anna, how are you today?
So.
I could understand. Tell me about your situation. How did you even find out that you were diagnosed with breast cancer?
Well, firstly, as I was taking a shower one day, I had a lump in my breast. So I told one of my family members, and they suggested that I go to the hospital. When I went to the hospital, they performed many tests to figure out what was the issue, because I was having a lot of pain.
Right.
So the doctors ended up telling me that I was diagnosed with breast cancer.
Wow. So, if you don't mind me asking, what is your race? Okay. Did you know that race can be a factor that could be one of the reasons as to why you may have breast cancer?
Really?
It sure can, and we can find out more about that from Dr. Henderson. What do you have to say, Dr. Henderson?
Thank you, LaShonda. So yes, looking at the races, you can actually see that there actually is a disparity and imbalances between the races. Caucasian women actually have the highest rate when it comes to breast cancer. If you look at African American women, they have a lower rate than Caucasians, but they actually have a higher mortality rate. If you look at Hispanic women, they actually have the lowest rate, but even though their rate is the lowest, it's still the #1 cause of breast cancer within the race.
Professor Allen, could you expound on the reason there would be a higher rate of breast cancer in Caucasian women, but a higher rate of death due to breast cancer in African American women?
Yes, you have to think about different things with health disparities. So like when you're coming from the race, and why African American women have a higher death rate is you have to also think about gender. Between males and females, males they have less than a 1% chance of actually getting breast cancer, but with females, it's the second leading cause of cancer outside of skin cancer. And so you go from there with females, you have to look at the biological factors. With African American women, they have twice the amount of estrogen as with Caucasians, so they have a higher risk of actually getting breast cancer. And then there's different ER statuses with cancer. There's a ER1 and an ER negative, and African American women tend to have an ER negative, which leads to a higher death rate than Caucasian women.
So, Professor Allen, you did mention that breast cancer is a higher risk in women. Why is it such a big health disparity for women?
Well, for women, you have to think about in this society what careers they're in. You have to think about how their lifestyle choices affect them. Women have estrogen, more than men. So obviously, with women, that's more factor for breast cancer. And then you have to go into breastfeeding. If they don't breastfeed, then they have more of a chance for cancer. If they have fewer kids, then they have more of a chance for cancer. If they have them later in life, there's actually a really increased chance for cancer. With the breastfeeding statistics, African Americans and Hispanics tend to breastfeed less. There tends to be a higher obesity rate with African Americans, and that can lead to breast cancer. And then with the whole having fewer children and jobs, that's really just like how career-oriented women are today, and so that just leads to their socioeconomic status.
Okay, so we touched on the topic of mortality rates with women who have breast cancer. Do you think this could be attributed to their geographical location?
While conducting my research, I actually found out that the death rates are recorded higher in the South due to the higher minority population that resides there. And also this coincides with their socioeconomic status and their lack of education regarding these health disparities and on how to seek help with regards of getting better.
Off what Dr. Gibbs was saying, I think all of the experts have spoken about how Caucasians have a higher rate while African Americans have a higher mortality rate. Another factor of this could be socioeconomic status. Poverty, poor education, and high unemployment rate have been linked to breast cancer disparities from treatments to diagnosis and screenings. 25% of all women live in poverty and 30% of single mothers live in poverty. As far as education, women with lower levels of education have lower rates of breast cancer screening than women with more education. So this just all means that women with low poverty and low education have a more greater chance of mortality.
So we've touched over many topics that have to do with health disparities in women with breast cancer. Dr. Claiborne, how do you think that affects access?
For example, Hispanics are less likely to have a primary care provider. Non-white Medicare beneficiaries have fewer cancer screenings, flu shots, and ambulatory visits. There are also barriers that exist, such as language and communication, which deals with cultural competency. There's also a lack of recommendation and the lack of recommendation towards minorities.
With all of the things we've discussed, you can tell that they tie in with each other. Your gender then affects your socioeconomic status, and then that affects your income, your education. They all tie in together. And so with cost, access, and quality, they're kind of a circle that affect each other. And wonderfully enough, we have the Affordable Care Act now in the U.S. And so with that, everyone is mandated to have insurance. And so insurance usually doesn't affect that access with people going to the hospitals outside of other issues with it. And then they don't negate against pre-existing conditions, and they don't negate against based on gender.
So Anna, now that you have been able to view this panel discussion, how do you feel, being able to hear some of the information that the experts had to say today?
Well, this panel answered a lot of unanswered questions that I had, and it gave me a lot of information that I didn't know. And I'm happy that we did this interview and these experts came, because now a lot of people that have the same situation that I have will be more knowledgeable to it.
Well, I'm glad you feel this way, Anna, and I hope that this video and our panel discussion helps many of the other young ladies out there who may be suffering from breast cancer. Join us again next week on the LaShonda Clark Show. Okay.
Yeah. You do what you want when you pop it. You do what you want when you cop it. You do what you want when you got it. Yeah. You do what you want when you pop it. You do what you want when you got it. Huh? Like the smell of that money.